Andrea Ferguson. I'm with Shanks Web Development. Shanks Web Development manages the marketing and communications of Direct Med Clinic. I'm here today with Dr. Roger Mochigamba of Direct Med Clinic, who is the founder, owner, and physician. Also, the chapter leader of the San Antonio Free Market Medical Association. Good morning, Dr. Roger.
Hey,
how are you?
Andrea. Great. How are you?
Good. The purpose of this is to give a conversation and answer frequently asked questions, and also address some of the rumors that have been circulating around the internet. We have people who are really not knowing what to do, not knowing what to believe, and it does influence their decisions. So today we'd like to talk a little bit about that and have some of your thoughts, as well as comment on interesting quotes and thoughts in the medical community.
Okay.
All right. So the first question I have for you is for the essential employees that are still working. They ask, should we avoid in-person meetings and group lunches? What are your thoughts?
Yeah, that's a good question. And so, first of all, we know what we need to do to try to contain COVID. We've been having that ingrained into us. And now we are at a point where the governor and I'm sure the city will start to have plans to relax the restriction and ease back into our economy. So to answer the question, I would say that to follow those guidelines first and then be very cautious. And if you can do a web meeting, or if you can get by without an in-person meeting, do that. But that being said, I too like to have lunch meetings. So let's just be very cautious about that and for sure follow the guidelines of our community leaders. So we don't want to have COVID come back and we'll have to shut down again.
That's a really good information there, to follow the guidelines. And we also see now that there are 918 cases in Bahar County, which includes San Antonio and surrounding areas. And it looks like the confirmed cases by age group are actually between 40 and 49 years old, although the deaths are still higher towards the elderly. Which brings us to the question about what can I do to prevent the coronavirus disease, either at home or at work?
Okay. So first of all, it's to maintain the social distancing and to keep doing the disinfecting like we've been taught to do. So keep following all of those precautions. That's very important because coronavirus is a disease that spreads so easily because it can be spread by somebody that doesn't even know they have it. So that's why that is so important. Now, there's starting to be another way to try to help protect yourself. And that's with the antibody tests that are becoming more available. So we know from the cruise ship incident that half of the people that tested positive with coronavirus were asymptomatic. Mm-hmm. And so as more and more of these antibody tests become available, you could think about getting an antibody test to see if you might be a carrier, or you might be one of those asymptomatic people, or maybe that you've had it already. The antibody test will help to know that. It will not, though, determine if you have active disease. So let me just make sure that people don't misunderstand what I'm saying. But that the antibody test could play a role in helping to determine if you've been exposed to COVID-19, and therefore it's just another tool in our toolbox to keep everybody safe and help our community get back online economically and socially and all that.
Okay, and you do further explain what you mean by antibodies in your video that talks more about the science behind the antibody testing. That's correct?
Right. So we have that.
And one of the last questions we have here is, can the virus that causes COVID-19 be spread through food, including restaurant takeout, refrigerated or frozen packaged food?
Wow, that's a good question. So my heart really goes out to all the restaurant owners in the community. They're taking such a hard hit. So I hope that we can all, keep that in mind and support them. But to my knowledge, that I've not seen anything that in the science that talks about how COVID-19 is transmitted through food.
And that's really important that you say that. It has to be science-based evidence that we're going by to really kind of direct our behavior, which brings us to some of the rumors circulating around on the internet. One prominent rumor circulating is 5G cell phone technology linked to the cause of coronavirus?
No, I don't see any. I've not heard any science about that. In fact, to the contrary, I've been studying, just like other clinicians and the rest of the medical world, how this thing happened. It started with a zoonotic jump, and then it started spreading person to person, and it's just a very infective virus, but it doesn't have anything to do with cell phone towers.
So zoonotic disease is when the disease begins in animals and then it transfers to humans. Then
Right.
we have contact person to person.
Right.
So there was no reason, you're saying, for cell phone towers to be set on fire in the U.S.
No.
because of that. Okay. Just for all of those out there that might be tempted to do the same. Okay. Are there any vaccines to prevent or medicines to treat COVID-19?
Yeah, so the vaccines are in development right now. And there are medicines that are being used experimentally to treat the sickest folks with COVID-19.
Okay. And are there, considering that we don't really have any vaccines or medicines out there, are older people and those with existing conditions the only ones at risk for coronavirus?
No, not at all. We all know that it affects all ages, but the folks that are up in years and have some chronic conditions, those are the ones that are most susceptible, but it does affect folks of all ages.
So I could get COVID,
Yes.
even though I'm young, I'm healthy.
Yes, and
Okay.
you could get it and have a mild case, but you could spread it to grandma or somebody that you know that is immunocompromised or has some chronic condition, and you don't want to do that.
And there's no way for me to find out if I've been exposed to COVID?
Well, there's the antibody test that we talked about in the other video, and you could find out. There's some limitations to the antibody test, which I talk about in that video. You can check that out and see what those limitations are, and see if getting an antibody test would be something that you would like to do, or might need to do, or might know people that should have an antibody test.
That's great. And you don't have to be a first responder, a healthcare worker, a bus driver to get the antibody test here at the clinic?
No.
Okay, that's good to know. All right, now that we have addressed the rumors circulating on the internet, we are going to get down to interesting quotes and thoughts in the medical community. I'm going to read one to you, and if you just give your initial thoughts or impressions, that would be great. So Jill Grimes says, in many communities, the small number of cases being reported is simply a reflection of lack of testing.
That's a good question. And that could be, but it could also be that the disease is there, but the folks that have it are asymptomatic. Time is going to tell on that one, though, because if there is that group of people that is asymptomatic in that community, they will become symptomatic, or they'll spread it to folks that will become symptomatic.
And just to be clear, when the lack of testing is mentioned here, I presume it's speaking of the PCR testing and not the antibody testing?
Up to this point, I think all of the talk that we hear about testing is the PCR test, the one that tests for active disease.
Great. Rabia de la Tour says, visitors, family, really no one is allowed to be at the bedside when you're infected with COVID.
Right. So you have an infected person in the hospital in bed, and then no one is allowed to be around that person. I'm assuming that's the question. So I know that's really hard. and those rules are there for a reason, because this disease is so contagious. If somebody is already in the hospital and they're that symptomatic with it, it could be that they have a more virulent strain, and we don't want to spread that one around. A lot of folks can have COVID and not even know it, or just have a mild disease. So I know it's really hard. I think in some cases there are exceptions, like if someone is on hospice or someone's dying. I don't know, but I feel it's important that we follow those rules.
So that it doesn't get to that point.
Mm-hmm.
That really kind of underscores the next thought in the med community, which is by Dana Coriel, who says we can't really see the emotional toll that the outbreak has on us.
Oh, I know. That's really hard, and I think about that from time to time, and it must be really hard on people to stay home for one, and then to see others suffering, and then to feel the economic burden. So my heart really goes out to them, and that's why I appreciate what you do and what Shanks does to help me get the word out, because we want to dispel the misinformation, and we want to try to get out good information. I feel like the knowledge I have as a doctor, I want to share with people so they will, the fears can go away and they'll know the facts. So thanks for doing what you do.
Mm-hmm. Well, we'll just end with one more, which is by Dr. Jake Deutsch, who's 46 years old. He said, I did get corona. I was actually sick for 2 weeks, had pneumonia, and it was probably the worst health experience that I have ever been through. And we know, doctor, that just 2 days ago, the first person younger than 40 in San Antonio died of COVID. This man was in his 30s. Considering that you can't actually be by the bedside when someone's infected with COVID, we can't see the emotional toll that the outbreak has on us. And now that doctors who are, 46 is relatively young, catching the virus and saying that it's the worst experience that they would have in their life, why is this antibody testing so important, and how does this help in all of this?
So antibody testing is so important because it's another tool in our toolbox to fight against COVID. It's not the be-all by itself, but it's another tool. And it's something that has its place. I mean, the PCR test has its place, the antibody test has its place, the social distancing, the disinfecting of everything, all of the shutdowns, all of that is part of the great massive effort we have to control this horrible disease that none of us could even imagine could have an effect like it's had a few months ago. So I hope that answers your question, and I hope
Absolutely.
It provides some great information to folks to help dispel their fears about COVID-19. We're always here to try to help with that, and provide value to the community, and take care of people and take care of their emotional fears also, their emotional needs or fears if we can.
Well, thank you, Dr.
bet.
Roger. Thank you so much for giving us the science behind the antibody test. You can also have a look at the video if you want to further understand what this chart means. Dr. Roger Mochigemba goes into it in detail, and we will be answering more of your frequently asked questions, as well as dispelling more rumors circulating on the internet. And if you have an interesting thought or quote that you would like us to take a look at, please go ahead and send it to office@directmedclinic.com. Please like, subscribe, and don't forget to stay safe.